cytokines. We have interferon, then we send for and then we send for شنو؟ قبل شنو send for شنو؟ من يعرف؟
histological state
we investigation has fever has
ESR
ESR and
serum
just X-ray to be sure we should have TB of lung or TB or non-TB. How come they send diagnosis for investigation? ماذا تسوي؟ شو تسوي؟ شلون أحصل بس والله شنو يسمى بزاف تيست هذا اسمه ليش؟ لا قبلها يوم قبل لا ما حصلنا شيء. إذا عندنا شيء سويدن ما في مشكلة. سويدن فور AFB. ما AFB هو set for AFB and culture يعني useful but is delayed. That takes many weeks, about 6 weeks. وهذا usually confirmation of the test by culture, but we shall start treatment before the field or the culture. No delayed. وهذا you can start treatment from the culture to be sure treatment. But AFB بس in this system is easy and rapid, and you can do in the early morning, as we said, about the 3 samples per day or 3 days will increase the yielding loss of the test. And we send the patient to the lab early morning before breakfast to the AFB, and in our hospital we have this facility, and in the chest institution in the somehow also have this facility for AFB bacilli. You see the bacilli in these sputum by special staining, nursing staining, you get the bacilli. This is diagnosis as we talked the last lecture, and we have a specimen for investigation, common specimen in the sputum for AFB, and also we can get gastric washing in case of children or female which swallow the sputum and lavage or biopsy. In case of external TB, we can get CSF fluid or stick fluid or pericardial fluid for assessment, and biopsy also can be used for histopathology for the, as we talk about the tests for diagnosis of TB, and lastly we talk about the empirical treatment of TB as one of the tools for diagnosis of TB. Okay, now we talk about the blood test اللي هو إجرا interferon gamma release assay يسمونه إجرا available in our country, in our society, in our town. إجرا interferon. شنو interferon؟ نعرف شنو interferon؟
سي دي 4 سيل تطرح على مود تقتل الميكروفيج.
cytokines. We have interferon in response to infection, we have cytokine. This cytokine release response present in any person. This interferon gamma released in response to infection by TB. Then by tuberculosis. We have a present in the antigen in the bacilli only, not BCG. So this test, patient have BCG vaccine and have TB infection. نسوي له tuberculosis test واحد positive or both. So we cannot differentiate between BCG infection or old infection or new infection. في حين الإدرة have been used for any person get infection in the last duration or last period of infection by TB, the T cell produce this interferon gamma. So when we re-stimulation of patient with TB bacilli, we get a result positive. So the patient have all infection or no infection. But BCG vaccine or the tuberculin test cannot differentiate between the BCG vaccine or TB infection. واضحة؟ In case of tuberculin test, we have a derivative of bacteria bovis and injected some intradermally to regain the response. راح يصير real. زين؟ شو البيشنت هو positive ولا negative. هذا يفيدنا إذا كان البيشنت عنده previous attack of TB or BCG vaccine. يعني ملقح هو أو عنده infection. ولهذا مين يزين infection. في حين الإقرأ لا. كان different بينهم only for bacilli tuberculosis antigen. Not to be positive in case of BCG vaccine. This is the X-ray in case of TB, also useful for the diagnosis as we talk. This is the destruction of the old TB and cavitation. This is fibrosis, and this is the cavitation indicating the active disease. This is the slide. We talk about the extrapulmonary TB, and we talk about the extrapulmonary TB. How patient present with manifestation of extrapulmonary TB. We have, as we talk, TB. In Samawa, we have two diseases endemic, and deeply endemic, TB and heart cyst. You can see heart cyst in any organ. I see heart cyst in the brain, I see in the bone, I see in the pericardium, I see in the lung, I see in the spleen, in the intestine, in the any organ, in the ovaries. لأنه عنده endemic. نفس الشيء TB in our society endemic. And you can get TB, any organ can get TB. TB of the meninges, TB of the bone, TB of the skin, TB of the lymph, TB of the pericardium, TB of the liver, TB of the intestine, TB of the peritoneum, TB of the uterine system. Any organ can be involved by TB, but the presentation is different. We have pulmonary TB, external TB, or mainly about 20% in young person. يعني patient إذا normal immune system 20% هو يكون external, 80% هو pulmonary. إذا كان patient HIV infected person, most patients يكون external, يعني يكون atypical presentation. فإذا patient HIV negative, زين like us, 80% يكون pulmonary TB. 20% يكون external. في حين case HIV infection لا العكس. So more external. It's a typical presentation. The most common sites هو lymph nodes, bone, serous membrane. نقول serous membrane معناتها pericardium, pleura and peritoneum. And the most serious one اللي هي mortality rate بها high تكون بها high complication اللي هي TB, TB and تكون high يكون involved meninges to high mortality, and even with healed patient or pure patient, we have sequelae of fibrosis of meninges to get this. So, lymphadenitis of the TB, we can get lymph node involved, commonly was cervical and standard lymph node commonly involved, followed by axillary and neural lymph node. 5% involved non-gamma region. May present as a primary infection or secondary as infection pulmonary. يطلع بالليف. We saw many patients يكون primary هو ليف. يطلع هنا swollen من الليف نود بعدين تفتح يسمونه colorectal abscess. زين؟ فكم اللي involved was cervical من الستاندرد then the axillary and igual. The node usually painless. يكون patient have lymph node يكون inflammatory. أما السبوستر infection تكون painful. يعني in case عنده viral infection أو كيس عنده مثلا viral infection أو أي bacterial infection تشوفون الليف يكون tender. البروبلم وين يصير إذا كان painless يعني ما يكون TB أو يجي فإذا كان البيشنت الليف تكون tender تكون less يعني less important يكون painless. يكون painless lymph node mobile then become matted together. شوفها كلها تزرسوها. And then caseation and liquefaction occur. The swelling become fluctuate, so like abscess, and then discharge the skin, causing colorectal abscess. Approximately half of patients show no fever and only abscess. والبقية لا كان يجد fever. Booking test تكون strongly positive, and during treatment some enlarged operation can occur, and sometimes require surgical excision rarely, sometimes controlled by the treatment. This is the example of abscess of the colorectal abscess. So this is the neck, and this is the cervical lymph node. This is number one, lymphadenitis. Number two, gastrointestinal, also common in our society, affects any part of the bowel. Commonly involved, we have two presentations. We have, as we talked in the last lecture, we have ileocecal disease. يكون patient having fever, nausea, weight loss, and present with palpable mass in the right iliac fossa, in the cecal area, and contender as surgical case. Third case is based on patients as surgical case. Ultrasound scan useful, sometimes require biopsy and animal to diagnose. Sometimes patient يفتحوا المريض ويشتغلوا يا ذكي. يعني كان يجيك patient severe attack of abdomen, not wait for the investigation. You do operation and then send for histology to get the TB results. Then we'll be put on TB. So this is the number one, ileocecal disease as right iliac fossa pain, as differential of right iliac fossa mass after الجراحة. Number two اللي هو common in medicine هو peritonitis. Come with fever, no pain, and night sweat, and high SR, and the patient have ascites. The acidic respiration will result in exudate. زين؟ من أقول exudate شو معناتها؟ هاي بروتين يعني معناتها infection. عكس شنو عكسها؟ transudate اللي هو يكون mainly fluid in case of over secretion, in case of overflow, in case of increased volume, in case of heart failure, liver cirrhosis, nephrosis. In all of that, there is risk of infection, so we can diagnose TB by the bacilli or the tuberculous histology of the laparoscope biopsy to get the tuberculous nodule in the peritoneum to get the different diagnosis of TB. But in this case, we have only high SR and this night sweat and acid fluid, which is that we can diagnose by empirical and TB, as we talk about our case, and have patient, young person from Khadr, come with pain and fever and high SR. We send for fluid aspiration analysis, which is that we shall start NTB. The patient responds in 2 weeks. So this is more document in the case TB. Okay, so the treatment can be useful for diagnosis. Number three, pericardial, and also common, and we have a case in the last week also with pericardial effusion, come with high fever and dyspnea. By echo, we have massive pericardial effusion. Pericardial effusion or fibrosis of pericardium, which is in this condition, causing cancer of the pericardium. The pericardium يكون calcified في حين الهارت يكون filled or surrounded by hard pericardium. So in case of fusion, the patient can with fever, not sweat, يكون patient have dyspnea and no swelling due to RV failure. Also you have muscle discus. زين؟ من يعرف شنو هذا؟ الأخير الأخير شنو هذا الفسيولوجي؟ من يعرفها؟ الأخير أخذتوها بالفسيولوجي والبشر. زين؟ أي؟
So exaggerate the difference between blood pressure between expiration and inspiration.
There is no more difference.
لكن 10 ملم.
More than 10. بس بدك تسكس كان measure the blood pressure during inspiration and expiration. Normally there is pressure what difference about less than 10. In case of rectal effusion, the patient have increased the difference between the systole and diastole in the
Systole.
expiration. Effusion have been enlarged heart filled with X-ray and generated by echo, and also can get inspiration. And this patient or patient will, and multiple patient in the hospital with effusion will aspirate يكون اسمه blood stain. لأن blood stain يكون emergency for embolism out in case of TB. يكون blood stain in the 85% of cases. Then our patient دخلناها يوم الخميس عشان نصحى حوالي الثانية من الجمعة الصبح. نقول الجراح الثاسك وجه العصر الجمعة ما اشتغل السبت الصبح. المهم after 2 days of treatment the fluid regress بحيث تسحب مثل الشيء. احنا يوم الخميس انه huge amount. On treatment regress about 2 days the fluid regress to the minimal amount. So the fusion we aspirate we get 85% of cases يكون blood stain. زين. Treatment هو mainly treat the underlying cause اللي هو TB and then corticosteroid. بس نجيش انت corticosteroid. المفارقة انه نعطي patient هو TB ونعطي immune suppressant. Why? The muscle as we talk, physiology and inspirations they are formed by decreasing internal pressure. Because the heart is in the thorax, the pressure entering the heart and causing bigger gap between the pressure and the venous outside the thorax and arterium. As such, with each inhalation, more blood flow into the right side. When this occurs, the septum will move to the left ventricle, وبالتالي lowering alveoli. شايلوها? Therefore, lowering systemic stroke volume, وبالتالي because the ventricle can normally also expand outward, this septum shift is very small and difference in the blood pressure increase more than 2. 10. خلينا نشوف كم شرح من اللي ما فهمنا. هذا الهارت هذا ال LV هذا ال LA هذا ال RA هذا ال RC. Okay? Normally we serve fluid inside around the cardium or inside the cardium. The most side affected, right or left? ليش؟
مصل
Aspiration. Yes,
القلب thick wall. الحين القلب لا، مو compression أكثر شيء. This artery when compressed, pushing the septum toward the LV. إذا كان normal free size or free space, the LV will be also like so the filling normal. But this movement outside and the pressure outside from the fluid, so decreasing LV stroke volume. بالتالي decrease aortic stroke volume. بالتالي decrease blood pressure during inspiration. During inspiration, negative pressure, then blood pass to this side, and this are the high thin wall راح يصير pressure الفوليوم أكثر. pressure منه راح يمشي أو decrease the volume because decrease pressure in inspiration. Normally, إذا ما في pressure outside ما تصير significant difference between the inspiration state. But when there is compression from outside, so this will be exaggerated and more than 10. Other causes of this phenomenon, rare effusion, in case of
constructive pericarditis.
ما عاد
Constructive cardiomyopathy.
انت مبرد
رجع عالي شوي.
هو effusion والهاي برشر يصير كمبريشن بعد
COPD دكتور.
اسمع increase negative pressure مثلا انه يصير تسنيح يصير شايفين اسمه يسوي شيء بعد من case of hypovolemia. The cause of muscle. So this manifestation can be seen in patients with fusion and residue will see pressure on the RB side. يحسن متوجري كمان أساس المصير increase flow from the vena cava إذا بيبقى demonstrateهم ascites بيكون اسمه localized side heart failure. Other CNS involved. CNS one ما خص neurology صراحة. بس احنا ننطلق له. We have three entities. We have tuberculous meningitis. We have tuberculoma, mass-like effect. We have abscess. And the patient has meningeal, most common form of meningitis involvement, and rapidly fatal. And we saw many patients fatal. We have many patients diagnosed as bacterial meningitis and receive TB treatment for bacterial meningitis, no response, and the patient or the senior emphasized this have TB meningitis and start treatment after 2 or 3 weeks when the patient have beyond treatment and patient get dead. Even when patient have treated and passed the mortality of 50%, the survival will be have sequelae of neurologic fibrosis of meninges and we get epilepsy or get nervous. So, and also we have indication for steroid in the case of meningeal involvement, and we talk about bone and joint for orthopedics. We have two entities. We have both disease involved the vertebrae, and we have abscess in the paravertebral also abscess. And this is the both disease will involve the disc and vertebrae and destruction, which is what the patient orthopedics. Then also we have manifestation of fever and rare. Patient often have of sterile biuria. sterile biuria. نعرفها. شو biuria؟ بس منور، biuria بس منور. زين شنو sterile؟ ماكو جرامستين جرام بوز يعني يصير جرامستين يعني بوز نكتيف ما يطلعش هاي كيس النسي شوف تي بي يطلع سترايل بايوري يطلع بس يل نو جروث زين بالجرام تي بي one of the causes زين. This case have diagnosed by microscopy and culture and women case infertility, meningitis, pelvic pain, and swollen meningitis, abscess, inflammation, and the else. And female, we have advanced and prostatitis. And this is the also classification of the kidneys, classification of the TB, and control prevention of TB. We can control TB by emotional education. Education and improve the sanitation. يعني proudness, health program, the most useful idea for the prevention. And patients become infectious, avoid to isolate the patient from the other family, and sometimes you can give access for the contact. And then we have the vaccine, like this patient, Chinese child, and this is the site of vaccine. All of you take the vaccine and have a scar in the left shoulder, and the scar, this indication indicate active or perfect functioning in the vaccine. The vaccine we call it Bacillus carnet curing bacillus اللي هو live in the vaccine derived from bovis يعني هو bovis stimulate immune mechanism against tuberculosis. This useful with life, but 60% response efficacy. But the main efficacy, main function of this vaccine was preventing the severe disease, the vaccine disease with meningitis. اللي قلنا تكون فترة. يعني هو صح هو الفاكسين with time يكون severe regress effectiveness, but the main function هو efficacy in preventing the severe disease. يعني حتى يصير disease يكون mesure meningitis. Okay? Vaccination politics or policies differ from one country to others, and in UK indication only they have contact within 2 years, immigrant, or infant with hypertension, ethnic group, or healthcare worker like us. دول نعطيهم this vaccine. In UK, in our country, any person, any baby born should be vaccinated within 1 week from labor time. Okay? نحن نقول بيان أن يسوي vaccine. زين. In some countries, only those who do not respond to initial tuberculosis test vaccine. يعني سويت ليش يلقحون المرضى ويسوون لنا اكو ريسك اوف انفكشن فينطون يسوون tuberculosis تيست بس البوزيتيف زين او سوري النيجاتيف يعطوه فاكسين يعني البوزيتيف يا اما هو اصلا انفكتد يا اما هو اصلا وصار له انفكشن وصار له ريجرس وعنده اميونيتي فينعطوه فاكسين بس النيجاتيف tuberculosis تيست يعطوه فاكسين. Grade 3 and 4 اللي هي increasing wheel size should be investigation for to exclude active TB. Tuberculosis skin test performed by this mechanism. Some countries do not use BCG لأنه will affect the sensitivity of tuberculosis test as we talked. Complication can be occurred in some person by abscess formation and infection in case of immunocompromised patient. Any question? Any question? نخص diagnosis and prevention. But prevention